Hello everyone, my name is Swapnil Arun Murke, and in this video we are discussing about the topic that is drugs used for peptic ulcer. Under this topic I am covering two subtopics, that is H2 antagonist and proton pump inhibitors. Now see the topic. First, what is introduction? What is peptic ulcer? Peptic ulcer is a condition which results due to imbalance of aggressive factor and defensive factor. And now see what is aggressive factor and defensive factor. Aggressive factors are those which are responsible for causing irritation or loss of gastric mucosa, and defensive factors are those which are responsible for protecting the gastric mucosa. Aggressive factor it includes gastric acid, gastrin, pepsin, Helicobacter pylori bacteria, and defensive factor includes prostaglandin analog, prostaglandin, mucosa, that is mucus, and bicarbonate ions and nitric oxide. When we see from pathology point of view, the peptic ulcer is a localized loss of gastric as well as duodenal mucosa leads to formation of peptic ulcer. Its symptom includes heartburn, abdominal pain, bloating, loss of appetite, and weight loss. Now see the classification of drugs for peptic ulcer. To prevent such peptic ulcer-like condition, we must first have to reduce gastric acid secretion, because gastric acid in excessive secretion is the main reason behind the peptic ulcer. Now, these are the four categories of drugs which are used to reduce gastric acid secretion. First, H2 receptor antagonist. It includes cimetidine, ranitidine, famotidine. Cimetidine nowadays not used because of its anti-androgenic action. Ranitidine and famotidine nowadays used. B. Proton pump inhibitors. It includes omeprazole, lansoprazole, pantoprazole. Nowadays, pantoprazole is now commonly used. C. Anticholinergics. It includes pyrinsepine and talenzapine. D. Prostaglandin analog. It includes only one drug, that is misoprostol. Now, before understanding the uses of drugs for peptic ulcer, we must first have to understand how gastric acid is secreted in stomach. Now see the mechanism. When food particles enter the stomach, food particles stimulate the G cells to release gastrin. Gastrin then binds to its respective receptor present on the basolateral surface of parietal cell. Parietal cell has not only one receptor, it has total 4 receptors. First, it has GR receptor or CCK receptor, also called CCK receptor. These are called gastrin. Second, H2 receptor for histamine, to which histamine binds, and M3 receptor to which acetylcholine binds. Together, these three helps in process of gastric acid secretion. These three together activates the H plus K plus ATP pump or proton pump and helps in release of H plus ions and increases the acid secretion in stomach. Now, drugs. H2 receptor antagonist. Cimetidine. It includes cimetidine, ranitidine, famotidine. Now, its mechanism of action is directly to blocks the H2 receptor and inhibits the gastric acid secretion. These drugs directly binds with H2 receptor and thereby histamine cannot bind to its original receptor and suppresses all phases of acid secretion, mainly nocturnal acid secretion. Now see its therapeutic uses. Its therapeutic uses include gastric and duodenal ulcer, gastroesophageal reflux diseases, stress ulcers and gastritis, Zollinger-Ellison syndrome also. Now also it has some adverse effects, like we see cimetidine has an anti-androgenic effect. In male, it produces gynecomastia and impotence, while in females, it produces menstrual irregularities and galactorrhea. It is enzyme inhibitor. It inhibits the metabolism of many of co-administered drugs, hence not to be given with other drugs because it causes drug accumulation and finally leads to toxicity. Now, second, that is proton pump inhibitors. It includes omeprazole, pantoprazole, lansoprazole, rabeprazole. And now, see its mechanism of action. Proton pump inhibitors, these are the prodrugs. These get activated in the form of sulfonamide cation, and then this binds with sulfidyl group of H plus K plus ATPase and finally inactivate it irreversibly and suppress the acid secretion in stomach. Now see, therapeutic uses of proton pump inhibitors includes peptic ulcer, H. pylori associated ulcers, NSAID-induced ulcers, gastroesophageal reflux diseases, Zollinger-Ellison syndrome, stress ulcers. It also has some adverse effects. It produces muscle and joint pain, rashes, leukopenia, headache, atrophic gastritis. Atrophic gastritis is one of the important side effects of proton pump inhibitors. Now, another drug is prostaglandin analog. It includes misoprostol, only one drug. It has a cytoprotective action. It increases the mucus and bicarbonate secretion and increases the mucosal blood flow. Its main therapeutic use is to treat NSAID-induced ulcers. It also has some adverse effects like diarrhea, abdominal cramp, uterine contractions and bleeding. Because it is a prostaglandin, it increases the GI motility, also increases the contractions in also uterus. If because of its multiple daily dosing, it has poor patient compliance. Now see MCQs from this topic. Which of the following is not an effect of cimetidine? Option A, impotence, B, gynecomastia, C, galactorrhea, D, atrophic gastritis. Correct answer is atrophic gastritis because other three are the adverse effects of cimetidine as we see in earlier. Which of the following is a H2 receptor antagonist? A, pyrazipine, B, lansoprazole, C, famotidine, D, misoprostol. Correct answer is famotidine as we see in classification. Third, which of the following is not effect of ranitidine as compared to cimetidine? Option A, action on H2 receptor, B, given orally, C, used with proton pump inhibitors, D, anti-androgenic action. Answer is anti-androgenic action because ranitidine has no any such type of adverse effects which cimetidine has. Now, fourth question, omeprazole acts by inhibiting A, Na plus H plus ATPase pump, B, H plus K plus ATPase pump, C, calcium channels, D, sodium channels. Correct answer is H plus K plus ATPase. That is proton pump or proton pump. Now, question number 5, that is proton pump inhibitors are most effective when they are given. Option A, after meal, B, shortly before meal, C, along with H2 blockers, D, during prolonged fasting periods. Correct answer is shortly before meal. Because proton pump inhibitors, these are the products and these are always effective when they are given before meal. Hence, correct answer is shortly before meal. Thank you.